Have you ever wondered if a simple painkiller, an innocent sleep aid, or even anxiety medications could have long-lasting effects on your memory and cognitive function? Drugs like opioids, sedatives, and antihistamines may make you feel comfortable in the short term, but if used long-term, they can diminish your mental faculties, leaving you feeling fatigued, confused, and unaware of the damage being done. Did you know that even the medications your doctor prescribes to help you sleep better or alleviate anxiety could cause extremely serious side effects that you never expected? In this video, we'll dive deep into the effects of these common medications and how they impact our brains. You'll not only learn about the dangers of these pills, but also discover solutions that can help protect your mind and cognitive health. If you find this topic important and want to safeguard your brain health, don't forget to like this video, share it so others can benefit, and subscribe to the channel so you won't miss out on other helpful videos. Together, we can keep our brains healthy and sharp. 1. Growing concern: medications and brain health. Over the past few decades, medicine has made incredible advances, providing life-saving drugs, reducing pain, and alleviating discomfort. Medications have become an essential companion for millions, especially for the elderly. However, in light of recent scientific research, an alarming truth is emerging. Some popular medications, though considered safe and helpful, can silently damage a very important part of the human body, the brain. We've grown accustomed to hearing about the effects of medications, but have you ever stopped to ask yourself, could this medication be affecting my brain? A recent study reveals that certain drugs, especially those commonly used, such as sedatives, painkillers, and blood pressure medications, can have serious impacts on brain health, leading to memory loss, confusion, and even dementia. So, what are the culprits silently attacking our brains? The first culprit I want to mention is opioids, benzodiazepines, muscle relaxers, and many other types of medications. While these drugs may offer certain benefits in treating symptoms, they carry a long-term risk to brain health that should not be overlooked. It's crucial to recognize the link between medications and mental faculties, so that we can make informed decisions about their use when treating health issues. Now, let's dive into the first medication: opioids. 2. Opioids, pain relief. That leads to confusion. Opioids, including powerful painkillers like oxycodone, morphine, hydrocodone, and codeine, have become an essential part of treating both acute and chronic pain, particularly for patients recovering from surgery or those suffering from persistent pain conditions. Opioids offer immediate relief from excruciating pain. However, what many don't realize is that behind this quick effectiveness lies a silent danger: the gradual cognitive decline that patients often don't recognize until it's too late. These pills aren't just pain relievers. They can diminish the brain's cognitive capabilities, leading to unforeseen negative consequences. Opioids not only lead to addiction, but they also weaken the brain, gradually impairing memory and causing cognitive issues like confusion and even dementia. When opioids enter the body, they act powerfully on the central nervous system by binding to opioid receptors in the brain and spinal cord. Their main mechanism is pain relief, by inhibiting pain sensation at nerve receptors. However, their influence doesn't stop at pain relief. They also affect other brain functions. Opioids reduce the activity of neurons responsible for memory and cognition. They alter areas of the brain associated with reward and pleasure. As a result, when used for extended periods, opioids can impair essential brain functions, including memory, focus, and even spatial awareness. This is why long-term opioid users may start to feel foggy, experience memory loss, and lose the sharpness they once had. Additionally, opioids can decrease white matter in the brain, a crucial structure that connects different brain regions, reducing the ability for various brain parts to interact. This leads to symptoms like confusion or reduced cognitive abilities, and even causes symptoms similar to dementia. Given the prolonged negative effects of opioids on the brain, recognizing the risks and discontinuing the use of these drugs is critical. However, stopping opioids should be done under medical supervision, as abruptly quitting can trigger severe withdrawal symptoms. To manage pain without harming the brain, doctors may replace opioids with other pain management methods, such as non-steroidal anti-inflammatory drugs, NSAIDs, non-addictive painkillers, or even physical and psychological therapies. Additionally, maintaining a healthy diet, engaging in gentle exercise, and managing stress are key factors in supporting brain recovery and protecting brain function. Studies have shown that regular physical activity, such as walking or yoga, can enhance brain health and support recovery from opioid use. One notable story of the harm opioids can cause is that of Sheila, a 72-year-old woman who used oxycodone after knee surgery. Sheila initially felt relief as the pain subsided, but soon after, she began to feel foggy and confused. One day, Sheila asked her husband why her bed was floating. Later, she forgot how to unlock her front door. These strange symptoms became more pronounced, causing her husband concern. After 3 years of using the medication, Sheila was diagnosed with early-onset dementia. Although Sheila only used painkillers for a short time, the damage they caused to her brain was subtle and went unnoticed at first. This illustrates that while opioids provide immediate pain relief, they can quietly attack our cognitive abilities and mental faculties. Sheila's story is a stark warning about the dangers of using powerful painkillers without proper oversight. According to neurologists and pharmacists, the use of opioids should be carefully considered, especially in older adults. Doctors often recommend that if strong pain medications are necessary, patients should discuss alternative, less harmful options for the brain with their healthcare providers. We usually prescribe opioids only for patients with acute pain and always limit their use to a short duration. If you or a loved one has been using opioids for an extended period, don't hesitate to ask your doctor for a re-evaluation and potential change in treatment. Brain health is paramount, and protecting it should be a top priority, said a neurologist. The harm opioids cause doesn't stop with memory loss. They can also lead to many other serious health issues. In the next section, we will explore another widely used medication that has a significant impact on the brain: Benzodiazepines, a class of sedatives. The quiet effects of this drug group will make you rethink what you're using on a daily basis. Stay tuned to learn more about these hidden dangers. 3. Benzodiazepines. Relaxation today, a clouded brain tomorrow. In today's fast-paced and stressful world, sedatives have become a go-to solution for many people. Specifically, benzodiazepines, with well-known medications like Xanax, Valium, and Ativan, are commonly prescribed by doctors for those struggling with anxiety, insomnia, or even panic attacks. These medications help soothe the nervous system, allowing patients to relax and drift off to sleep easily. However, what few realize is that after each dose of relaxation, our brain is silently facing a long-term danger. While benzodiazepines provide immediate relief, they also have a significant negative impact on the brain when used over the long term. This can lead to a heartbreaking reality. The brain's sharpness begins to fade, memory starts to blur, and over time, it can even increase the risk of conditions such as dementia. So, how can these seemingly harmless drugs cause such worrying consequences for our mental faculties? Benzodiazepines work by enhancing the effect of a neurotransmitter called GABA, gamma-aminobutyric acid. GABA helps reduce the activity of nerve cells, creating a sense of relaxation and calming the central nervous system. This is why benzodiazepines are used to treat anxiety, sleep disorders, and panic attacks. However, the inhibitory effect of GABA not only helps users relax, but can also affect other brain functions, especially memory and cognition. When used long-term, benzodiazepines can reduce the brain's flexibility, leading to impaired memory and information processing. One of the most noticeable negative effects of this drug group is the reduction in brain volume in areas related to memory and judgment. Over time, the brain becomes clouded, making it difficult for users to recall information and possibly leading to confusion and severe cognitive decline. While benzodiazepines can offer temporary relief from anxiety, the long-term solution is not to continue depending on them. Doctors recommend that if you are using sedatives, you should seek alternative methods to manage anxiety and improve sleep without harming your brain. One effective solution is participating in psychological therapies, such as cognitive behavioral therapy, CBT. CBT helps patients learn how to manage emotions and reduce anxiety without the need for medication. Relaxation techniques like yoga, meditation, or even deep breathing exercises also help reduce stress and improve mental health without side effects. Additionally, maintaining a healthy lifestyle with a nutritious diet and regular physical exercise is key in improving mood and protecting the brain from the negative effects of sedatives. Walter, a 69-year-old man, is a prime example of the long-term harm benzodiazepines can cause. After the death of his wife, Walter began experiencing difficulty sleeping, and his doctor prescribed lorazepam, a benzodiazepine, to help improve his sleep. Initially, the medication helped Walter sleep better, but after a few months, his family started noticing strange changes in his behavior. Walter began doing irrational things, like rummaging through trash cans, leaving his car running all night, and even forgetting his actions during the day. This raised concern for his family, and they sought medical help. After 3 years of using lorazepam, Walter was diagnosed with moderate dementia. Doctors explained that long-term use of benzodiazepines had led to a decline in his memory and judgment abilities. According to neurologists, the use of benzodiazepines must be closely monitored, especially in older adults or those with a history of cognitive issues. While these medications can help relieve anxiety and improve sleep in the short term, they should not be used long-term without a change in treatment methods. Doctors advise that when using sedatives, patients should discuss alternative methods to manage anxiety, such as psychological therapies, exercise, and other relaxation techniques. Some patients just need a little help to overcome anxiety without relying on long-term medication, and sometimes properly discontinuing medication under the supervision of a doctor can greatly benefit your brain health. Now that we have a clearer understanding of the negative effects of benzodiazepines on the brain and how they can impair cognitive abilities, we will explore another class of drugs that also have significant and detrimental effects on the brain: muscle relaxants. 4. Muscle relaxants. Relaxing muscles, but stretching. The brain. Muscle relaxants are common medications prescribed by doctors to treat muscle pain and tension, often seen in individuals with conditions like back pain, neck pain, or muscle strain. Drugs like cyclobenzaprine, methocarbamol, and tizanidine work by relaxing the muscles, reducing pain, and providing instant relief. However, what many don't realize is that while these medications relax the body, they can also stretch the mind, leading to severe impacts on brain function. Furthermore, long-term use of muscle relaxants can lead to memory issues, cognitive impairment, and even an increased risk of dementia. Although muscle relaxants help relieve pain and improve body flexibility, they can also cause prolonged side effects that patients may not be aware of. So, what is the impact of muscle relaxants on the brain, and how can we protect brain health when using them? Muscle relaxants primarily work by inhibiting the central nervous system, reducing muscle tension, and creating a sense of relaxation. These medications act on the nerve receptors in the brain and spinal cord, stopping or reducing the neural signals that cause muscle strain. However, this inhibition not only affects the body, but also impacts cognitive functions in the brain. The main mechanism of muscle relaxants is to decrease the activity of neurons in the brain, particularly those related to memory and cognition. When the nervous system is overly inhibited, the brain becomes fatigued, sluggish, and loses its ability to focus. Long-term use of muscle relaxants can result in confusion, short-term memory loss, and difficulty maintaining focus. Additionally, studies have shown that prolonged use of muscle relaxants can reduce cognitive function, leading to impaired decision-making, poor information processing, and even a sense of being dazed or foggy. While muscle relaxants can provide quick relief from muscle pain and promote relaxation to protect the brain and avoid long-term side effects, patients need to find ways to minimize their dependence on these medications. Some alternative solutions include physical therapy, PT. Physical therapy exercises, massage, and treatments like chiropractic care can help reduce muscle pain without the need for medication. These methods promote flexibility and overall body health without negatively impacting brain function. Relaxation and stress reduction techniques, yoga, meditation, and deep breathing exercises help reduce muscle tension and pain without medication. These techniques also enhance physical resilience while protecting brain health. Proper nutrition and regular exercise. A diet rich in nutrients, especially anti-inflammatory foods like fish, leafy greens, and berries, combined with regular exercise, helps keep the body healthy, reduces muscle strain, and prevents pain. Controlled use of muscle relaxants. If muscle relaxants are necessary, patients should adhere to their doctor's prescription and use them only for short periods. Additionally, it is important to have regular checkups with a doctor to monitor health status and any side effects. Yvonne, a 73-year-old woman, is a prime example of the potential harm caused by long-term use of muscle relaxants. After the death of her husband, Yvonne began having trouble sleeping, and her doctor prescribed cyclobenzaprine to help with muscle pain in her neck. Initially, the medication provided relief, allowing her to move her neck more freely. However, after a while, her family started noticing strange behaviors. Yvonne began confusing household items, even pouring milk into her shoes without realizing it. On one occasion, she mistook the kitchen for the bathroom. At first, her family thought the confusion was just due to aging. But after a medical evaluation, Yvonne was diagnosed with vascular dementia. Doctors explained that the long-term use of muscle relaxants had caused a decline in her memory and severely affected her cognitive abilities. According to neurologists, the long-term use of muscle relaxants can have undesirable effects on the brain, particularly in older adults or those with a history of neurological issues. While muscle relaxants are very effective in relieving pain and improving body flexibility, when used long-term, they can reduce cognitive abilities and cause memory problems, said a doctor. Doctors also recommend patients try alternative treatments like physical therapy, massage, and relaxation techniques like yoga or meditation. If muscle relaxants are necessary, patients should follow prescribed dosages and timelines, while regularly monitoring side effects to adjust treatment methods as needed. The effects of muscle relaxants on the brain are a serious concern and must be fully recognized. However, this is just one part of a larger issue concerning the uncontrolled use of medications. In the next section, we will continue exploring the harmful effects of other drugs, such as antihistamines and sleeping pills, on brain function. Stay tuned to learn how these medications can affect your mental health and how to effectively protect your brain. 5. First-generation antihistamines, allergies, or cognitive decline. When you experience allergy symptoms like a stuffy nose, sneezing, or itchy eyes, antihistamine medications are a common solution to relieve those uncomfortable symptoms. First-generation antihistamines, such as Benadryl, diphenhydramine, chlorpheniramine, and promethazine, are widely used, easily available, and effective at reducing allergic reactions. However, there is a lesser-known side effect that users often don't recognize. These medications can have a serious impact on memory and cognitive function, particularly in older adults. These first-generation antihistamines not only alleviate allergy symptoms, but can also have long-term effects on the brain, impairing memory and increasing the risk of developing dementia. So, what exactly is the impact of these drugs on the brain, and is there a way to minimize the risks? Antihistamines work by blocking the action of histamine, a chemical released in the body during allergic reactions. Histamine is responsible for causing symptoms like itching, runny nose, sneezing, and congestion. By blocking histamine, these drugs reduce these symptoms. However, first-generation antihistamines do more than just block histamine receptors. They also affect acetylcholine receptors in the brain. Acetylcholine is a neurotransmitter crucial for memory, learning, and attention. When antihistamines inhibit acetylcholine, they can impair brain functions, leading to memory issues, poor concentration, and an increased risk of cognitive decline, such as Alzheimer's and other forms of dementia. Additionally, first-generation antihistamines cause drowsiness, reduce alertness, and induce a foggy, groggy feeling, which further contributes to the negative impact on brain health. When used over an extended period, these effects can accumulate and harm the brain. While first-generation antihistamines are effective in relieving allergy symptoms, users should be aware of their potential side effects. To minimize the impact on brain health, here are some strategies patients can consider. Switch to second-generation antihistamines. Second-generation antihistamines, such as loratadine, Claritin, cetirizine, Zyrtec, and fexofenadine, Allegra, do not affect acetylcholine receptors in the brain, making them less likely to cause drowsiness or cognitive impairment. These drugs can be a safer alternative for people who need long-term allergy medication. Alternative therapies. Instead of relying on antihistamines, natural methods can be used to manage allergies, such as using saline nasal rinses, modifying the diet to boost the immune system, or trying therapies like acupuncture and herbal treatments to reduce allergy symptoms. Reduce dosage or discontinue medication when not needed. If allergy symptoms are no longer severe, discuss with your doctor the possibility of reducing the dosage or discontinuing antihistamines. This can help minimize the negative impact on brain health, especially for older adults or those with a history of neurological conditions. Healthy diet and lifestyle, boosting the diet with antioxidant-rich foods and brain-healthy foods like salmon, berries, and leafy greens, along with maintaining a healthy lifestyle with sufficient sleep and regular exercise, will help protect the brain and improve cognitive function. Franklin, 71 years old, started using Benadryl, a first-generation antihistamine, every night to help with sleep due to his allergies. Initially, he didn't notice any issues, but after a year, his family began to notice unusual signs. Franklin started repeating questions, forgetting recent conversations, and even misplacing simple items like his wallet. One time, he even put his wallet in the freezer and insisted that someone had moved it. 2 years later, Franklin got lost while driving to church, a place he had visited weekly for many years. By that time, he was diagnosed with early-onset Alzheimer's. Doctors stated that his long-term use of first-generation antihistamines contributed to his memory decline and cognitive impairment, particularly during his crucial later years. Neurologists agree that prolonged use of first-generation antihistamines can be a hidden risk factor for cognitive decline, especially in older adults. We advise patients to use second-generation antihistamines if possible, as they have less impact on brain function. If first-generation antihistamines must be used, patients should take them at a low dose and only for short periods. Additionally, don't forget to make lifestyle changes, maintain a healthy diet, and exercise to protect brain health, doctors suggest. Franklin's story serves as a reminder of the unexpected side effects of first-generation antihistamines on the brain. However, other medications may also cause significant harm to cognitive health. In the next section, we will explore the dangers of sleeping pills and their impact on memory and cognition. Stay tuned to learn how these medications can affect your mental health and how to effectively protect your brain. 6. Sleeping pills. A good night's sleep, a mind standing on the brink of danger. Sleep is a crucial factor in maintaining overall health. And for those who struggle with sleeping pills seem like a life-saving solution. Medications such as Zolpidem, Ambien, Lunesta, and Temazepam are prescribed to help patients fall asleep more easily, restore energy, and improve mental health. However, there is a truth that few recognize. While sleeping pills can provide a good night's sleep, They also come with serious side effects for the brain, gradually affecting our cognition and mental function over time. While sleeping pills can help alleviate temporary insomnia, long-term use can harm the brain, impair memory, and lead to cognitive decline. These side effects may not appear immediately, but by the time they do, it may be too late. So, what exactly do sleeping pills do to the brain, and how can we protect our mental faculties while still ensuring a good night's sleep? Sleeping pills, also known as sedatives, work by inhibiting the central nervous system, helping patients easily fall asleep. Modern sleeping pills like Zolpidem, Ambien, and Lunesta often target GABA, gamma-aminobutyric acid receptors, a neurotransmitter that reduces brain activity, creating a relaxing and sleep-inducing effect. The mechanism of action for these medications is fairly simple. They inhibit the activity of neurons in the brain, reducing alertness and helping the user quickly fall asleep. However, this effect doesn't stop when you sleep. It also influences other brain functions, including memory, cognition, and response time. When used for long periods, sleeping pills overstimulate GABA receptors, disrupting natural sleep processes and impairing the brain's recovery during sleep. This leads to memory loss, difficulty concentrating, and even a foggy feeling upon waking up. While sleeping pills can be a quick solution for a restful night, long-term use can lead to concerning side effects for the brain. To minimize risks and protect brain health, there are several alternative strategies you can adopt. Cognitive behavioral therapy for insomnia, CBTI. This scientifically backed method addresses the root causes of insomnia without the need for medication. CBTI helps patients change poor sleep habits and thoughts, improving sleep quality without side effects. Meditation and yoga practices. These methods not only help relax the body, but also reduce stress and anxiety, two common causes of insomnia. Deep breathing exercises, meditation, or gentle yoga can help you relax and prepare for deeper sleep without relying on medication. Healthy diet and lifestyle, limiting caffeine, alcohol, and stimulating foods in the evening can improve your sleep. A diet rich in magnesium, vitamin B, and omega-3 fatty acids can also improve sleep quality. Alternative sleeping pills. If you need medication to aid your sleep, discuss with your doctor about using milder sleeping pills or alternative treatments, such as melatonin or natural sleep aids. Judith, 69 years old, started using Zolpidem to cope with her insomnia. Initially, the medication helped her sleep better and feel more relaxed. But after a few months, her family began to notice unusual signs. Judith frequently woke up in the middle of the night in a dazed state and even forgot her actions while wandering around the house at night. On one occasion, she mistakenly called her daughter by the wrong name and even used a fork to comb her hair. When her family took her to see a doctor, Judith was diagnosed with mild cognitive impairment, MCI, an early stage of dementia. Doctors pointed out that the long-term use of sleeping pills disrupted the natural process of brain cell regeneration during sleep, impairing her memory and cognition. Neurologists and psychologists state that sleeping pills should only be a temporary solution and must be closely monitored. Sleeping pills can help improve sleep in the short term, but long-term use can have serious effects on memory and cognition. I advise patients to seek alternatives like cognitive behavioral therapy, CBTI, meditation, and yoga to maintain good sleep without harming the brain, said the doctor. Doctors also recommend that when using sleeping pills, patients should follow the prescribed dosage and only use them when absolutely necessary. Additionally, if possible, patients should work on gradually reducing their dependency on medication to avoid long-term side effects on brain health. While sleeping pills offer a good night's sleep, long-term use can lead to significant impacts on cognitive health. However, sleeping pills are just one of many medications that can affect brain function. In the next section, we will continue to explore the harm caused by other types of medications, such as antibiotics and antidepressants, on the brain. Stay tuned to learn how these drugs can affect your mental health and how to effectively protect your brain. 7. Statins, cholesterol-lowering drugs that may affect brain energy. Statins are a widely used class of drugs that help reduce cholesterol levels in the blood and prevent cardiovascular diseases, particularly for individuals at high risk of heart-related issues. Medications like atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor, have helped millions of people live healthier lives by reducing the risk of stroke and other dangerous cardiovascular diseases. However, there is a downside to statin use that many people don't realize: the negative effects they can have on the brain. While statins can protect heart health, they may also affect brain energy and function in ways that many don't immediately recognize. Recent studies show that long-term statin use can lead to memory loss, fatigue, and even cognitive issues. So, how exactly do statins impact the brain? And is there a way to balance their benefits for heart health with the protection of brain function? Statins work by inhibiting the enzyme HMG-CoA reductase, which is essential in the production of cholesterol in the liver. By lowering cholesterol levels, statins help reduce plaque buildup in the arteries, lowering the risk of cardiovascular diseases like heart attacks and strokes. However, statins not only affect cholesterol, but also impact a critical nutrient for the brain, coenzyme Q10, CoQ10. CoQ10 is an important antioxidant that helps provide energy for cells, including nerve cells in the brain. When CoQ10 levels decrease, neurons lack the energy needed to function efficiently, leading to fatigue, memory decline, and even cognitive problems. Furthermore, some studies suggest that reducing cholesterol too much can weaken the function of nerve cells and reduce the ability to form new connections in the brain. This could lead to impaired learning, decision-making, and even contribute to memory-related diseases like Alzheimer's. Although statins may cause some side effects for the brain, not everyone using statins experiences these problems. However, there are several solutions to minimize the negative impact and protect brain health while continuing to use statins. Supplement with coenzyme Q10, CoQ10. Those on long-term statin therapy should consider supplementing with CoQ10. CoQ10 can help improve cellular energy and protect neurons from the negative effects of cholesterol reduction. Many doctors recommend CoQ10 supplements for statin users because it helps boost heart health and support brain function. Regular cholesterol monitoring, close monitoring of cholesterol levels, is essential when using statins. Doctors can adjust dosages to ensure cholesterol remains at safe levels, preventing it from being too low, which helps protect both heart and brain health. Healthy lifestyle. To reduce dependence on medication, patients should maintain a balanced diet rich in antioxidants, vitamins, and minerals, beneficial for brain health. Regular exercise and an active lifestyle are also crucial for maintaining brain health and overall well-being. Discuss alternatives with your doctor. If you experience side effects from statins, talk to your doctor about other alternatives, such as non-statin, cholesterol-lowering drugs, or other treatment methods. Hank, 72 years old, began using statins after his doctor discovered his high cholesterol levels and risk for cardiovascular disease. Initially, Hank felt healthier, but after a period of using the medication, he began experiencing unusual symptoms. He frequently felt fatigued, had trouble remembering conversations, and forgot important details throughout the day. One morning, Hank asked his wife why her name sounded strange, and a short time later, he couldn't recall what he had done the previous evening. When Hank's family took him to the doctor, he was diagnosed with mild cognitive impairment, MCI, an early stage of dementia. Doctors stated that his long-term use of statins had contributed to his memory decline and cognitive impairment due to a reduction in CoQ10 levels, which affected the brain's energy. A cardiologist stated that while statins provide many benefits for heart health, they must also be considered for their side effects on the brain. Statins can lower cholesterol levels and prevent dangerous cardiovascular diseases, but they can also affect brain function, especially in older adults. If you're using statins, be sure to regularly monitor your cholesterol levels and supplement with CoQ10 to support brain energy, the doctor advised. Doctors also emphasize that if you experience symptoms like fatigue, memory loss, or difficulty concentrating while on statins, you should discuss adjusting your dosage or exploring alternative treatments. While statins provide cardiovascular benefits, they can also have unintended effects on brain function. However, these impacts are not unique. Other medications, such as antidepressants and anti-anxiety drugs, can also affect cognitive health. In the next section, we will continue exploring the effects of these drugs and how they may impact your brain. 8. Proton pump inhibitors, PPIs, impact on nutrition and gut microbiota. Proton pump inhibitors, PPIs, are one of the most commonly used classes of drugs for treating stomach issues, particularly gastroesophageal reflux disease, GERD, and stomach ulcers. Medications like omeprazole, Prilosec, esomeprazole, Nexium, and pantoprazole, Protonix, are widely used to reduce stomach acid production, helping relieve discomfort from symptoms like heartburn, stomach pain, and indigestion. While PPIs provide immediate relief and make patients feel better, there is a growing concern about their long-term use. They can affect gut microbiota and nutrition, potentially leading to serious consequences for overall health. When the stomach does not produce enough acid, the body has difficulty absorbing important nutrients like vitamin B12, calcium, magnesium, and iron. The gut microbiota may also become imbalanced, impacting the immune system and digestion. So, what exactly do PPIs do to the body, and how can we minimize these effects when using the medication? Proton pump inhibitors, PPIs, work by inhibiting an enzyme called H+Ka+ATPase, or the proton pump. This enzyme plays a key role in producing stomach acid. When the proton pump is inhibited, the amount of stomach acid significantly decreases, helping prevent issues like acid reflux and stomach ulcers. Although PPIs are effective in reducing acid, the decrease in stomach acid production can cause several potential health problems. Stomach acid not only helps digest food, but also assists in absorbing vital nutrients, including vitamin B12, calcium, magnesium, and iron. When acid levels drop, the body's ability to absorb these nutrients also diminishes, leading to nutrient deficiencies. Moreover, inhibiting stomach acid changes the microbial environment in the gut. The acidic environment helps control the growth of harmful bacteria, but when the acid level drops, harmful bacteria can proliferate, leading to an imbalance in gut microbiota. This imbalance can affect the immune system and digestive health, potentially leading to digestive issues and overall health problems. While PPIs can help alleviate stomach symptoms, there are several ways to reduce their side effects on nutrition and gut microbiota. Supplement essential nutrients. Those using PPIs long-term should consider supplementing important vitamins and minerals like vitamin B12, calcium, magnesium, and iron. Supplementing these nutrients will help counteract the deficiencies caused by the medication and support overall health. Try alternative methods. If possible, patients should explore alternative ways to manage stomach issues without relying on acid-suppressing drugs. Natural methods such as adjusting the diet, reducing stress, and using digestive supportive herbs like ginger and licorice may help improve symptoms without affecting nutrition or gut microbiota. Monitor and adjust dosages. When PPIs are necessary, patients should follow their doctor's guidance on dosage and duration of use. This will help minimize side effects and help patients maintain long-term health. Additionally, if stomach symptoms improve, doctors may reduce the dosage or discontinue the medication to avoid long-term side effects. Healthy diet and lifestyle. A healthy diet rich in fiber, fruits, and vegetables, combined with maintaining a healthy lifestyle, helps support digestion and protect gut health. This not only helps maintain digestive health, but also supports immune function and protects the gut microbiota. Mabel, 74 years old, had been using omeprazole, a PPI, for many years to treat her GERD. The medication helped Mabel reduce discomfort from symptoms like heartburn and reflux. However, after long-term use, Mabel began to feel fatigued, lacked energy, and had trouble concentrating. One day, when she smelled food, she noticed a strange metallic taste and couldn't eat even a small bite. When Mabel's family took her for a checkup, the doctor discovered she had deficiencies in vitamin B12, calcium, and magnesium, essential nutrients needed for proper nerve and muscle function. The doctors believed this deficiency was due to her long-term use of PPIs, which had impaired her ability to absorb these nutrients. A gastroenterologist explained, PPIs are an effective tool for treating GERD and stomach ulcers, but they are not a long-term solution. Prolonged use of PPIs can lead to deficiencies in essential vitamins and minerals, affecting gut microbiota and overall health. I advise patients to closely monitor their nutritional status and supplement essential nutrients when using this medication. PPIs, although effective in reducing stomach symptoms, can have serious impacts on gut microbiota and overall nutrition. However, this is not the only case. 9. Antipsychotic medications. Anxiety, relief, memory loss. Antipsychotic medications are an important class of drugs used to treat psychiatric disorders, including schizophrenia, bipolar disorder, and severe anxiety. These medications help patients reduce symptoms such as delusions, hallucinations, and extreme anxiety, allowing them to return to a more normal life. Some common antipsychotics include risperidone, Risperdal, olanzapine, Zyprexa, quetiapine, Seroquel, and haloperidol, Haldol. However, while antipsychotic medications can help patients manage severe symptoms, they also have a significant downside: their impact on memory and cognitive function. Long-term use of these medications can reduce memory ability, cause cognitive disruption, and even increase the risk of dementia. So, what exactly do antipsychotic medications do to the brain? And are there ways to mitigate these side effects? Antipsychotic medications primarily work by targeting dopamine receptors in the brain. Dopamine is a crucial neurotransmitter associated with feelings of pleasure, learning, and attention. People with psychiatric disorders like schizophrenia often have abnormalities in dopamine activity, leading to symptoms such as delusions and hallucinations. Antipsychotic medications reduce dopamine levels in certain areas of the brain to help control these symptoms. However, reducing dopamine too much can cause unwanted side effects, particularly in memory and cognition. When dopamine is overly suppressed, brain functions such as attention, memory, and decision-making can be affected. Additionally, some studies suggest that long-term use of antipsychotics can reduce brain volume and damage regions of the brain associated with memory and emotion. While antipsychotics can help manage severe psychiatric symptoms to minimize the negative impact on memory and cognition, there are several strategies that patients and doctors can implement. Lowering the dose or switching medications. If patients experience memory or cognitive side effects, doctors may adjust the medication dosage or switch to a different drug to minimize these effects. Newer generation antipsychotics like aripiprazole, Abilify, and lurasidone, Latuda, tend to have fewer cognitive side effects compared to older medications like haloperidol, combined with psychotherapy. To reduce dependence on medications, psychotherapy, particularly cognitive behavioral therapy, CBT, can be used alongside medications to improve mental health without negatively impacting memory. This therapy helps patients cope with symptoms and reduce anxiety without relying solely on medication. Regular cognitive health monitoring. Patients should regularly check their cognitive and memory health with their doctor to detect any signs of cognitive decline early. This helps adjust treatment plans and protect brain health. Healthy diet and exercise. A balanced diet rich in omega-3 fatty acids, antioxidants, and vitamin B12, combined with regular physical exercise, can support brain function and reduce the effects of medications on memory. Leonard, 71 years old, was prescribed quetiapine to treat his severe anxiety and sleep disorder. Initially, the medication helped Leonard feel relaxed and fall asleep more easily, but over time, his family began to notice strange changes in his behavior. Leonard started doing irrational things, like pouring syrup into soup, asking why the person in the mirror was responding to him, and even forgetting recent conversations. His family became concerned and took Leonard to see a doctor, where he was diagnosed with mild cognitive impairment, MCI. Doctors explained that his long-term use of antipsychotic medications had affected his memory and cognitive function. They clarified that while the medication helped Leonard control anxiety and depression, it also had serious side effects on brain function. Psychiatric specialists noted that antipsychotic medication use needs to be closely monitored, particularly in older adults or those with a history of neurological issues. We always encourage patients to monitor their cognitive health regularly while using antipsychotic medications. And if any signs of memory loss appear, we adjust the treatment plan. The key is to find a balance between controlling symptoms and protecting brain health, the doctor said. While antipsychotic medications are highly effective in managing serious psychiatric disorders, they also have negative impacts on memory and cognition. However, antipsychotic medications are not the only drugs with side effects on the brain. In the next section, we will continue to explore the effects of other medications, such as antidepressants and anti-anxiety drugs, and learn how they can affect your brain. 10. Tricyclic antidepressants, TCAs, solving anxiety but causing harm. Tricyclic antidepressants, TCAs, are an older class of medications used to treat depression, anxiety, and mood disorders. Drugs like amitriptyline, imipramine, nortriptyline, and desipramine have helped millions of people improve their quality of life by alleviating symptoms such as depression, anxiety, and insomnia. However, what many people fail to realize is that despite their effectiveness in treating depression, these medications come with serious side effects on the brain, particularly affecting memory and cognitive function. When used long-term, tricyclic antidepressants can lead to issues such as memory loss, difficulty concentrating, and decreased information processing ability. The concerning part is that these side effects can persist and negatively impact the patient's quality of life, making it challenging to perform daily tasks. So, what exactly do TCAs do to the brain, and is there a way to protect our mental faculties when using this medication? Tricyclic antidepressants work by increasing the levels of neurotransmitters like serotonin and norepinephrine in the brain. These two neurotransmitters are essential for regulating mood, sleep, and anxiety. These drugs help improve the patient's mood and alleviate symptoms of depression and anxiety. However, TCAs not only affect serotonin and norepinephrine, but also influence other neurotransmitters, particularly acetylcholine, which is crucial for memory and learning. When acetylcholine levels are reduced, neurons can't function efficiently, leading to memory impairment and poor concentration. This is why one of the common side effects of tricyclic antidepressants is causing a foggy feeling, memory issues, and reduced cognitive ability. In addition, TCAs can cause other side effects such as drowsiness, dizziness, and arrhythmia, leaving patients feeling tired and low in energy throughout the day. These side effects can become more pronounced when the medication is used for extended periods. While tricyclic antidepressants can be effective in treating depression and anxiety, there are several strategies patients and doctors can employ to minimize the negative effects on memory and cognition. Switch to newer antidepressants. Newer antidepressants, such as SSRIs, selective serotonin reuptake inhibitors, like fluoxetine, Prozac, and sertraline, Zoloft, have less impact on acetylcholine and have fewer side effects compared to TCAs. Patients should discuss with their doctors the possibility of switching to these medications if they experience significant side effects. Psychotherapy. In addition to medication, cognitive behavioral therapy, CBT, can help patients learn to cope with depression and anxiety symptoms without relying heavily on medication. CBT helps change thought patterns and behaviors, helping individuals overcome psychological challenges without affecting their cognitive abilities. Regular cognitive health monitoring. If a patient is using TCAs for an extended period, they should regularly monitor their cognitive health and memory with their doctor. This allows for the early detection of any signs of cognitive decline, which can lead to adjustments in treatment plans. Healthy diet and lifestyle. A healthy diet rich in omega-3 fatty acids, vitamin B, and antioxidants will help protect brain health. Additionally, maintaining regular exercise habits helps improve mood and boost brain function. Leonard, 71 years old, was prescribed amitriptyline to treat his chronic nerve pain. Initially, the medication helped him reduce pain and feel better, but after several months, his family began noticing unusual signs. Leonard started doing irrational things, like pouring syrup into soup, asking why the person in the mirror was answering him, and even forgetting recent conversations. His family became concerned and took him to see a doctor, where he was diagnosed with mild cognitive impairment, MCI. Doctors explained that his long-term use of tricyclic antidepressants had affected his memory and cognitive abilities. They stated that, while the medication helped Leonard control his anxiety and depression, it also had serious side effects on his brain function. Psychiatrists noted that the use of tricyclic antidepressants needs to be closely monitored, especially for older adults or those with a history of neurological issues. We always encourage patients to monitor their cognitive health regularly while using tricyclic antidepressants, and if any signs of memory decline appear, we adjust the treatment plan. The key is to find a balance between controlling symptoms and protecting brain health, the doctor said. Tricyclic antidepressants, while very useful in managing severe psychiatric disorders, also have negative impacts on memory and cognition. However, TCAs are not the only drugs with side effects on the brain. In the next section, we will continue exploring the effects of other drugs, such as antidepressants and anti-anxiety medications, and learn how they impact your brain.